and welcome back to That's What She Said. My name is Mercy. Hope you all are doing good. Today on the episode, we have a Chief Dermatologist and Head of Clinical Services at Armora Skin Solutions, Dr. Monisha Aravind with us. Welcome to That's What She Said.
Hi, Mercy.
So good to see you again. And
Same here.
so I have to mention before, we go ahead with the podcast. I've been following you for quite some time, and I love the content that you put out. And even though I wanted to, get you on the podcast, I thought I'm going through a rough phase with my skin. Let me first consult you. So I've been consulting you for a few months, and my skin is reacting to it slowly. One more thing that I realized is when I came to you, I think usually, when you see a dermatologist, people have this thing of, please give me some magic potion that will transform my skin overnight. And you told me, no, you don't need anything. This is all that you have to do, and thanks for that. Do you get this a lot though? Do people come to you and be like, "Edavadu kudunga enoda skin maaridno?"
Exactly. A lot of people, even my patients who've been with me for almost 5-6 years, they also come and ask me, "Are you sure this is it? Do you want me to add something on?" Like, no, this is enough. You're good.
Yeah, and I'm so glad that someone like that is there, because I've seen few doctors. I've seen, I've changed dermatologist. I've always had a very extensive skincare routine, and I'm so used to that. And when I came to you, you gave me like 2 things, and you said, "Do this. This is enough." I was like, "Okay, are you sure?" So yeah, that's what, right?
There's a plus and minus to it.
Correct.
The same thought of, oh, okay, are you sure that this is enough?
Correct.
Yeah, and it's like, okay, I'm glad that you didn't give me too much.
That's true.
There's a plus
And
minus
I'm
to it.
also glad that you asked me to see what's actually happening, because I had a lot of acne and you asked me to do some tests. So thanks that I did it. And we kind of understood there are some underlying things that I need to fix. So really, really thanks to you for actually.
That's my job.
Yes. Cool. So, doctor, let's start our discussion. Since I'm going through an adult acne phase, I want to start on that, right? And I'm sure a lot of people who are watching this also will be able to relate to that. Tell us, how does adult acne even happen? Like, what are the main reasons that adult acne starts?
See, adult acne could be a new terminology, but I would say it always existed. It's not that it is something new that creeped up, no. Just that our parents didn't pay attention to it.
Correct.
Mainly, the adult acne happens only because of the hormonal changes. So it doesn't mean you should have hormone imbalance. It's just a surge. Every 5 years once, especially for women, there is a surge of hormones which happens, because of which your glands, your sebaceous glands, acts up.
Right.
That's it. That's a major reason for adult acne. Though it is a 50% of the cause, the rest 50% is what we have been doing.
Correct.
So it's not that, you've just started on a clean diet, or you've been working out like for the past 3 months or for the past 1 year, and you can't expect your skin to be good.
Right.
It's what did you do in your teens? Now, if
Correct.
your teens, if you messed up with your diet, or you didn't realize at least like around 20 years that, okay, this is something not good to my body and I have to start working. If you don't come to that realization, or if you do not start working on your own body early in your adulthood, you will end up having adult acne.
Okay. So let's say when someone, has a lot of acne, what do you think are the things that they need to keep a check on? Like, I remember when I came to you, you immediately you didn't give me skincare, right? Like, you told me to do the test. So can you tell us these things that you need to keep a check on, especially for women post 30?
Mainly the hormones. Always check your thyroid as well as your other hormones like your testosterone, prolactin levels, the AMH values, because these matter a lot.
Right.
We need to know, see, most of the times it would be normal. I would say like around 80% of the times it could be normal, but you will tend to know that there is some minimal changes, especially in your prolactin levels.
Right.
Not that you need to go on medications. That's not the point of checking the hormone levels. The point to check your hormone levels is to say that you have to come back on a proper lifestyle.
Correct.
To keep a checkpoint for your stress levels, the food that you eat. If you've not been working out, start working out, just to pinpoint that you've been missing out these things.
Right.
And of course, it's a lifestyle which takes the second seat.
Of course.
So you need to work on your lifestyle. You need to know that, you have to start working out, eat healthy, make sure you sleep on time.
Yeah.
Having
important.
7 hours of sleep doesn't matter.
Right.
Sleeping on time matters.
Okay.
If you're gonna sleep around 12 o'clock, 1 o'clock, and you have good 7 hours of sleep, doesn't matter. Your body is not going to be good.
Okay.
It's still going to react up. You have to stick with the biological clock as well as your circadian rhythm.
Right.
So you have to sleep at 10 o'clock, max 11, not after that, because your melatonin secretion is not going to be great.
Okay.
So if that's not going to be great, then your body's messed up no matter how long you sleep.
Okay.
So the hours of sleep doesn't matter. The time that you go to bed and you wake up matters a lot.
Okay.
So that's definitely something you need to work on. After all this, the rest of the things. So you check your hormones, you see your hormones are okay, check your lifestyle, see your stress levels are okay, see if you're eating on time, sleeping on time, and if you're stress free.
Yeah.
And then come to the products that you've been using.
Correct.
See if there is something going wrong there. So that's how you rule out.
That's really interesting what you said, that hours of sleep doesn't matter. You have to sleep on time for even to whatever we are eating and everything,
Yes.
for it to work. So when we are talking about acne, I think we have to talk about isotretinoin, right? Something I feel every second or third person that I've known who've dealt with acne have taken that pill. And one thing that I've also noticed, whoever has been taking that pill, is that when they are taking that pill for that 6 months, for that 3 months, their skin really clears up. And then once they stop it, after a couple of months, it again flares up. What's the process like? Is it even safe to use? And is it okay for you to keep using in intervals? Because my sister herself had a very, problematic acne issue during her teens. Now she's fine. But every time she stopped, any doctor we went to, they immediately gave her that pill. So how safe is it?
See, isotretinoin is nothing but a vitamin A derivative. Okay, it's a retinoid, which everyone talks about.
Yes.
The retinol.
Yeah.
It's an oral form of retinoid. And it is safe until or unless your doctor prescribes it and you're under a supervision on taking it. It's not a pill where you can just go get it, not like your oral antioxidants.
Correct.
So when it comes to acne, there are few acne that doesn't even respond to any of the treatments. We do topicals. See, there is a stepladder pattern of treating acne. Start with the topicals first. If the topicals is not responding, then put you on a course of combination, like with a topical as well as an oral antibiotic. Still not responding, put you on isotretinoin or starting on procedures. Now, if someone doesn't want to start on isotretinoin, we also start with procedures first and see if that's coming down with it.
Right.
Still, if it is not coming down, then you have to step up to isotretinoin.
Right.
And there are few patients who might need isotretinoin at the right beginning itself. The acne which is like nodular cystic, the big acne which is very problematic.
Right.
And there it is even more concerning because it could be more complicated. So there you might need isotretinoin very early also. So it totally depends upon your treating physician, like when do they want to start isotretinoin on you.
Okay.
And now coming to isotretinoin, it's basically going to shrink your oil glands.
Okay.
The acne is stemming up from the sebaceous gland. Now you shrink the gland, make that gland inactive, your acne is not going to come anymore.
Correct.
And the problem with that is that you will have more dryness because the oil production is going to lower.
Of course, yeah.
So basically, how much ever your hormone hacks up, your glands are not going to react. It's
Okay.
going to stay calm in place.
Going to numb it.
Yes.
Okay.
So that's why isotretinoin works well.
Okay.
Now, when you start isotretinoin, there is a duration of course you have to really take it. It's not like a pill you start and stop.
Right.
You start, okay, your acne cleared up and I'm stopping this. In next 3 months, your acne is going to come up.
Of course, yeah.
For sure.
Yeah.
That's because your glands are just going down, shrinking. And once you stop the tablets, it's acting up again.
Correct.
So now when you are on the medication for a while, the glands understand, okay, this is how much I should act. I should not overreact. So now for that understanding for your body to happen, you have to take it for a while.
Okay.
But again, it is dose dependent manner. Not that you keep taking the same dose forever,
Right.
the regularly for 6 months or for a year. you slowly reduce it, taper it, and then you understand how the glands react.
Right.
So now this understanding, when you work with your dermatologist, they know it better.
Of course.
They know when to reduce or when to increase or
Right.
when to stabilize it.
Right.
Now the problem why there is a recurrence is, once you stop the medication, one is your gland is going to act up. Most of the time they don't use any topical medications to maintain.
Right.
That is when the problem comes up. Now, once you stop isotretinoin and you maintain your skincare with topicals, like a topical retinoid or a topical adapalene, some forms of medications to keep your acne under control,
Right.
then it is under good control.
Okay.
So even I have patients who've been taking isotretinoin for a while,
Right.
but then there is a way of taking it off, putting
Right.
them on a topical treatment to keep it under control.
Correct.
Even if you do all of this, when the lifestyle again messes up, it's going to mess up.
Of course,
Now
of
that
course.
is why acne keeps coming up, and I would say acne is a lifestyle problem.
Very true. Very true. And so, does it make you dependent on the pill by any chance?
No, it doesn't.
Okay.
It's only when you want to depend on the pill. Like as I told you, when you don't take an initiative of changing your lifestyle, or like,
Right.
okay, I'm taking the pill and I'm okay with it,
Correct.
until you get dependent on it, no, you
Okay.
don't generally don't.
Okay, all right. We are in 2025, but still the craze of being fair has not faded away, right? Everyone's talking about this
Yeah.
magic potion called glutathione, and there's been IV drips, there's been powders and supplements and everything. Can you tell us about glutathione? What exactly is happening there?
See, basically, glutathione is an antioxidant. Glutathione is there in your body. Everyone has glutathione. You have glutathione. I have glutathione, naturally produced in our body.
Right.
Now, antioxidants, basically, there are multiple antioxidants which is available. Glutathione mainly took a place because it was accidentally found when it was given as a treatment for cancer, that as a side effect, they become more fat.
Oh, okay. Okay.
So that's how glutathione came into the market.
Okay. Okay.
Of I would say like the fairness market.
Got it. Got it. Yeah.
And there are a lot of doses available. There's 10,000, 20,000, 30,000, a lot of IV doses that's
Right,
available.
right.
But you need to understand that it's not in a magic potion. You take glutathione through IV, probably for 2-3 days, you're going to look glowing, more fair, and then your color is going to come out.
Okay.
Because it's out of your body next to 3 days.
Yeah. Right.
Not more than that. It's just an IV, that's it. It's not changing the mechanism of how your melanin production works.
Right.
It doesn't change anything at all.
Right.
So glutathione is an antioxidant, and you can treat it as an antioxidant, but not a magic potion
Okay.
to become fair.
Right.
No, you will not. So imagine you end up taking glutathione forever in your life. We don't know if anything is going to happen.
Right.
We do not have enough studies to say or support that it's completely safe.
Right.
See, it's said to be safe because it's out of your body.
Right.
Now the overdose, when you keep taking it on a long run, we really don't know. We do not have enough studies to support that.
Right.
We need more data to support if it's okay, if it's completely fine or not, if there is going to be any overload happening in your body, if there is going to be, of course, anything overdose is toxicity.
Of course.
So keeping it within the limit is always good. I'm always for oral glutathione because it's a good antioxidant, and orally you need just minimal dose. Even if you take 1000 mg max or 1500 mg also, what is going to act up in your body is only 500 mg.
Right.
So on that note, it's good. It's safe to take because there is a lot of cellular damage which is happening to us. And when it comes to skin, the skin gets damaged internally, externally, both the ways.
Correct. Yeah.
And externally, the environmental damage is very bad.
Right.
Like every day to day, you get exposed to it. And of course, we also have stress. So now the stress is going to cause more damage to the cells. And now glutathione helps in repairing those cells.
Right.
So when you repair, you have a good cellular energy happening and regeneration happening. So you're of course gonna look good.
Okay.
And even if you get tanned or even if you have a injury or a sunburn, it's gonna heal quick.
So, can anybody take a glutathione supplement without a doctor's prescription?
I would say no.
Okay.
Because again, you should know when to start and when to stop.
Okay.
One. And again, to know that if you really need it or not.
Okay, and how do we know that? Like, do we need to go through some tests or something?
No, not medications. At
Okay.
first is the age. So no,
Okay.
when I say don't take it without a doctor's prescription is only majorly because of the age.
Okay.
Because the teens are getting more vulnerable to, becoming more fair.
That's true.
Because that's what they talk in schools.
That is true,
So
yeah.
now I don't want someone to go take the pill and start taking the pill.
Exactly.
So
yeah.
that's why not without a doctor's prescription.
Right.
But otherwise, like above 25, and you know that you have a lot of stress in your life,
Right.
and you have a lot of sun exposure, getting tanned a lot, you're good to go with the pills.
Okay. Okay. All right. So we can go and get a pill and like go
Yeah, see,
ahead with it.
majorly know that you have to take it for 3 months continuously, and then take a break for 3 months, and then again take it for 3 months.
Like
So in a
every other
year,
supplements.
yeah.
Okay.
So in a year, do not exceed 6 months.
Okay.
That's your limit of taking glutathione as well. So
Okay.
for any supplement,
Okay.
just give a break from that, and then again get back onto it.
Okay, got it. So I have to tell you something that's happened with me when we're talking about being fair and all of this, right? So during lockdown, this was just before lockdown started. I had gone and seen someone, and they had prescribed a cream to me. All right. So lockdown started, which means I was using that cream every night. It was a night cream. So March, April, May went by, and I used that cream almost like every night I used it. And by June, I realized I have become white. Like my face became white. Not only white, I didn't have a spot on my face. Like literally, I had like an amazing skin. There was absolutely no spots, no acne or anything. And of course, when you have this kind of a skin, you tend to get addicted. You're like, you want this again. So I went back to that person asking for that cream, and they said they don't give that cream anymore. And I thought, okay, fine, let me go and order it online, right? I came back home. I took that bottle, and to my surprise, I cannot tell you how stupid I felt at that time. It was a golden bottle. There was no name written on it. There was no ingredients written on it. It was just a golden bottle. And then I was talking to a friend of mine about this, and she was telling me maybe it had hydroquinone on it, right? Because right after that cream got over, my skin went through the worst phase. Like it started breaking out. I had dull skin. I had dry skin. Like for the next 6 months, I almost struggled to bring back my original skin color, basically. So how safe is hydroquinone? Is it even advisable to be having it in your creams? What would you suggest?
See, now hydroquinone is not the culprit there.
Okay.
Because hydroquinone is a very good ingredient to help in reducing hyperpigmentation. But you should again know when to start hydroquinone and when to stop hydroquinone. Now, the problem with these nameless creams is not just hydroquinone. The reaction that's happening to your skin is not only because of hydroquinone, it's because of a steroid as well as mercury.
As well as?
Mercury.
Okay.
So now these two are the main problem here. Now talking about hydroquinone, until or unless you're under a prescription based hydroquinone, you're good to go because your doctors know when to stop it. They'll slowly take it out of your skincare. There are few indications where hydroquinone is the only drug which is going to help.
Okay.
Because the rest doesn't work to that extent. But not that everyone needs. Hydroquinone is not for you to become fair. It is to treat a hyperpigmentation condition. It's not for you to become fair at all. So if you do not have any indication, no, hydroquinone is not the drug and you cannot keep using it. But if you have an indication, then yes. Now again, as I told you, hydroquinone can't be used for more than 3 months or 4 months continuously. It has to be taken out and replaced with something else to keep it under control. Why? Because hydroquinone is a drug which is going to kill your melanocytes.
Okay.
Which is going to basically kill your cells, which is going to produce pigment.
Right.
That's why you have this fair effect. Okay? And now when you stop it, your cells will regenerate.
Correct.
You will have your pigment back.
Correct.
So it's going to come back again. Now the skin reacting up, the acne flare up or skin becoming very sensitive, red, happens because of steroid and mercury.
Okay.
Not because of hydroquinone. So when you get dependent on steroid and when you suddenly stop steroid also makes you fair.
Right.
And once you suddenly stop steroid, you will have a lot of acne breakout. Because steroid is an anti-inflammatory. It keeps your inflammation under control, but that doesn't mean you can keep using it for long. Steroid side effects itself is to give acne.
Oh.
when you use steroid, even for a very short time, when it is indicated, there could be some reactions happening like acne and all.
Okay.
That's how it basically works. So once you stop it, you will have a flare up. And the sensitivity of your skin comes because of mercury.
Okay.
Or if there is a high dose of retinoid added to it, like a tretinoin, you don't know. When it is nameless, you don't know what is there in the
exactly.
bottle.
Yeah. That was a very bad experience I had, and I was actually almost very scared. After that, every time I even took a cream, I used to like see if there is
See.
hydroquinone, because if it's there, I'm not going to use it, because it was very temporary, and it almost killed my confidence, right? Like, skin really has that thing to make or break your confidence. When your
Yes.
skin's great, you feel great, and when it's not there, you it can really break your confidence. So that was a very bad phase of my life. So let's talk about fillers and Botox, right? Like, people seem to be doing it so easily these days. Like, even a 22-year-old, 23-year-old. I was watching this podcast recently, actually. So this girl is 23-year-old, and she was saying she wants to get fillers done this year. This is what she's going to do this year. And it really took me by surprise that a 23-year-old girl is even thinking of getting a filler, because it's been so normalized. Can you tell us first the difference between a Botox and a filler, and then we'll get to if it's safe and everything?
So now filler, as the name goes, it's going to fill a space. And it is made up of hyaluronic acid. There are, of course, a lot of other forms of fillers which is available, but hyaluronic acid is the one which is widely used by all the doctors. And Botox is not a filler.
Yeah.
Botox is quite different. It is a neurotoxin which is going to stop your muscle action.
Okay.
Okay, so usually Botox is given for fine lines. Like when you frown or when you smile, you
Right.
get these crow's feet
yeah.
and these fine lines on your forehead.
Yeah.
This is because of your muscles.
Correct.
When you move your muscle, it moves. And for you to reduce that, you need a Botox to stop the muscle to work. But Botox is not long lasting because the Botox acts on your nerves and stops the nerves to supply the muscle. And these nerves will regenerate back.
Of course.
New nerves comes back. So because of which your muscles will come into action again. So that's why it is not a permanent thing. It's a
Okay.
very temporary molecule which works only for up to 6 months.
Okay.
4 to 6 months, I would say, because for few people in 4 months it's out. That's how Botox works. Now fillers is to fill a space or to give more augmentation to the face, to a shape to the face.
So how safe is it to use though?
See, safety wise, who's injecting for you is more important. Make sure that if they had a certified dermatologist or a plastic surgeon to inject a Botox or a filler. Now, good hands matters because fillers, if it goes wrong, it can be immediately corrected.
Okay.
But the person who's injecting should know that if it's going wrong or not.
Okay.
So that's why who injects matters a lot.
Right.
And if that person is confident, then you can trust them and go ahead. Now coming to the rest of the complications, you have to stop doctor shopping when you want to go for fillers.
Okay.
Because there are a lot of people who get a filler done with some other doctor, Dr. A. They get it done a month ago. And they go to Dr. B, they do not give this history, and they go get it done it again.
Okay.
Okay. One, it's going to look bad. Of
Right.
course, totally messed up. Two, over fillers can pressurize your vessels.
Right.
And that can cause a problem. Even if the injector is not at a, not to be blamed. Because when they inject, we know if we are in the vessel or not with few signs. Okay. We might feel okay, it's all good. But then they end up with a complication in a week or so. That's because of too many products sitting there pressurizing your vessel and that leading to a complication again.
Right.
So it is definitely not safe to do that. So you cannot doctor shop when you want to get a Botox or a filler done.
Okay.
Same applies to Botox. You get a Botox with Dr. A 1 month ago. Now the effect is going to be there with you for at least 4 to 6 months.
Correct.
And you go to Dr. B, get it done next month. Imagine you're becoming plastic. You want to move your muscle, you cannot.
So people do that, is it?
Yeah,
Do
yeah,
they
people
it,
do
like,
that.
even though they know it's going to be there for 4 months, do they do it immediately?
Yes, they do that. That's because the Dr. A would have denied to do a retouch.
Oh.
See, because we know, again, the art of aesthetics is to know when to stop.
Correct.
You can start whenever you want, but you should know when to stop.
Right.
If you do not know that line, you're gone. It's a
Right.
mess.
Right, right. So let's say when someone comes to you and they want to get a filler done or a Botox done, does the doctor take a call or they say, no, I want to get it done, I want to do it?
When it comes to me, I take the call. If
Okay.
I don't want to do it, I will not do it.
Okay. And how do you take that call if you want to do it or not? Do they have to go through some tests?
No, no, no. It's only with the history one, as well as you know that if they want it or if they don't want it. So now, mostly when someone comes asking for a filler, either it would be for a lip or it would be for the under eye area. Now, under eye area fillers are very tricky because if you have tear trough, which is if your eyes are sunken, it's going to work very beautifully.
Correct.
But if you have bags, then you need to correct the bags before even you inject a filler, because filler is not the only option to correct your eye bags. It might even make your eye bags look even prominent.
Okay.
So it's going to make it worse. So you need to where to inject. Also, when because this happens only because people do not have an awareness of how the filler works. So they come and ask that they want a filler here. You ask them, why do you want a filler on your jawline? I want a lift. Now, if when we examine, we might know that they don't even need a filler here. They need a filler here because when you lift, they lift.
Correct.
That's it.
Yeah, yeah.
So that's how fillers work. Not that you go inject the fillers exactly in a place where you need it. You have to play around. That's when fillers work beautifully without showing up. Or sometimes they might even not need a filler at all.
Right.
For example, as I told you, eye bags. Eye bag doesn't need fillers. You can do it with radio frequency, with HIFU, and then you can fix it. Or sometimes you might need a minimally invasive procedure rather than going for a filler at all.
Right.
So that's how we take a call if they need filler or if they do not need a filler. But always, when a patient comes asking for a filler, I would first counsel them, wait for them to come back with an answer.
Okay.
I do not do the filler on the same day.
Immediately.
Immediately. No, you come for the consultation first. You understand the pros and cons of it. You understand how it's going to react on your skin. You should know how your face is going to look for the next 1 week after the filler, because you might have an inflammation there because of the pricks by itself. And it takes around like 2 weeks for your filler to calm down, settle in. So I need to know if they are going to be in town, if they are going to be traveling.
Right.
I need to know what they want or how their lifestyle is before even I just, okay, you come and you walk in, you want a filler, come, let's do it. No, that's not
Correct.
how it works.
Right. Can you see a person and tell if they've got fillers or Botox?
Yeah, of course.
You can, huh?
Yeah.
Or you have that thing. You can totally see through them.
Yes.
That's crazy though. Have you had any incident where someone comes and says, I've never gotten anything done?
Of course, yes.
But
And
you
we
can
can
see
make
through
out,
it.
yeah.
Oh no. That must be fun to know it already.
So that's when we reject.
Okay.
Yeah. Your skin is good to go, I know
Okay.
that it's tricky to touch.
Right. I've been seeing again, right? Instagram has become this huge place of information and also misinformation. There's a lot of content that's actually giving you the right information, but you can also get carried away and believe something that is not true at all, right? Another thing that I've been seeing is that retinol. Again, I think retinol வந்து 25க்கு மேலனா கண்டிப்பா retinol போட்டே ஆகணும் அப்படின்ற நிறைய ரீல்ஸ் நான் பார்த்திருக்கேன். How true is it? Because I remember when I came to you also the first consultation, I asked you retinol கொடுத்திருக்கீங்களா அப்படின்ட்டு.
It's not just you,
Yeah.
it's anyone.
Okay.
Anyone who comes in for a consultation, the first thing, ரெட்டினால் கொடுத்துட்டீங்களா எனக்கு அப்படின்னு. முதல்ல சன்ஸ்கிரீன் போடுங்க, அப்புறம் ரெட்டினால் போடலாம்.
Correct தான். Yeah. So is it necessary for everyone to use retinol after a certain age?
Absolutely no. If everyone needs it in Keta, no.
Okay.
Kandipa illave illa, not everyone. There could be few ingredients which could work better than retinol for you. So if you need retinol or if you don't need retinol, doesn't depend upon your age, depends on how your skin looks.
Right.
How sensitive your skin is, how dry your skin is, how pigmented your skin is. Now, if your skin is sensitive, I will not give you retinol. If you have a very dry skin, I will not give you retinol. If you have acne, I need retinoids to treat your acne, so I will not put you on retinol there. If you have pigmentation, again, I have better ingredients to work on pigmentation than retinol. So here, again, I will not prescribe retinol.
Okay.
So it depends upon how your skin looks and what your skin needs. That's why it's always better to go to a dermatologist, get a consultation done, and then get the
Yes.
ingredient rather
Right.
than experimenting.
Yeah.
Because there are people who come and say, I've been using retinol. Okay, stop it. It's okay. You don't need retinol right now. Yeah, I can put you back on retinol later on,
Right.
but you need something else right now.
Right.
So it's only what you need at that point of time. That's how skin works. So skin doesn't work the same for everyone.
Right.
25 years, I will give retinol. 25 years, I will not give retinol.
Okay. Do you ever get annoyed because now everyone knows about skin too much, right? Like they are reading up on it. There's skin influencers on Instagram, and when they come and ask you these questions, do you get annoyed?
Practically, I should not get annoyed.
Okay.
See, because there are a lot of information. As you told, there are a lot of misinformations.
Right.
So we are here to clear those doubts.
Of course.
So I can't get annoyed when people come and ask me, because they're asking because they don't know the answer. That's why they're asking that questions.
Right.
Only if they ask, they get to know what is right and what is wrong, and they can take a decision, informed decision about that, right? So I will definitely not get annoyed. I only get annoyed with one question: are you sure? I'm very sure.
I know.
The only question I get annoyed is like, after giving all that explanation, are you sure, doctor? Like, I'm of course very sure. That's what I've studied for.
Of course, right? That's so true. Let's talk about laser treatments, right? Like it's being marketed as permanent hair reduction, right? Permanent hair growth வந்து அப்படியே நிறுத்திடும் அப்படின்ட்டு. I have got my laser done on my upper lip and chin, and I'm doing my maintenance sessions now. Like, what's the deal with it? Like, why are people marketing as something it's a permanent solution, but it's actually not, right?
Yes. See, this marketing was not done by professionals. The marketing of permanent hair removal, because I remember when I was a kid, like even before I came into medicine or into dermatology, I've seen a lot of parlors doing laser hair reduction.
Correct.
There it is used to be promoted as laser hair removal, not
Removal,
as
correct.
reduction.
Yes, yes.
Laser hair removal. Even I believed, oh, it's laser hair removal. Okay, when I was like around 12 years or 13 years, I was like, okay, after 18, I'm going to get the laser hair removal done, and it's all gone.
Yeah.
Only when I came into dermatology, when we studied about the science behind how the mechanism is, we understood, okay, this is not removal, this is reduction. And only when dermatologists came into the picture, it changed into hair reduction.
Right.
It's not removal.
Right.
That's because the science was not known. That's it. Why it's not removal? Because you cannot remove an organ out of your body.
True. Yeah.
Okay, so the hair comes out from a organ which is called the pilosebaceous gland, which is a sebum, as well as the hair gland which is attached together. So the sebaceous gland and that's what is called as pilosebaceous gland. Now you can't remove that gland out of your body.
Right.
It's well there inside your body. You can't do anything to remove that.
Right.
Now what you can do is reduce the thickness of the hair. So once the laser shot is given, now this laser again works only on pigmented hair, which means only on black hair, not on white hair.
Oh, really?
When there is no pigment,
Okay.
laser doesn't work.
Oh, how's that?
See, laser works only by a few mechanisms. You need something within the cell structure for the laser energy to get absorbed.
Okay.
One is the melanin, two is the water, three is the blood vessels.
Okay.
Okay, so this is where the laser is going to work. Now, the laser hair reduction missions usually work on the pigment and the blood vessels. So, it reduces the blood supply, shrinks the blood vessels, and when there is a pigment, it breaks the pigment, and that energy gets dispersed to the surrounding area and reduces the surrounding area's power to give you a new hair.
Okay.
That's how it basically works.
Okay.
So now you give a shot, that hair becomes thin. So thick hair becomes thin, like a fine hair, like how you had this peach
Yeah.
fizz on the skin.
Right.
So it's going to become thin, it's going to become fine, and the growth is going to get delayed. That's it.
Okay.
So we are not going to remove anything out of your body. We are only changing the mechanism of how it is naturally working. That's it.
Right. Okay. Wow. This is something I had no idea that it works only on
Yes.
pigmented hair.
Only on pigmented hair.
Moving to hair, right? Everyone wants to look put together. And there are all these treatments, keratin and cysteine, and these days there's something called a hair Botox. How safe are these to get done for your hair?
See, once in a while doesn't matter. But you should understand that there are a lot of chemicals which is going to go into your hair. Of course, it's not going to enter into your body and do a damage until or unless you're not getting exposed to it very often. If not, you're safe. Like doing it once in a year, twice in a year doesn't matter. But understand that because there is a lot of chemical exposure, when you have weans off, you need a good care.
Correct.
If you do not give that care, of course it's going to get damaged. If you give that enough care, then you're in a good.
Okay. And out of these three, which one do you think is the most safe?
It's all the same.
All the same. It's just being marketed differently. Oh no.
See, there are few ingredients which changes, but it's all the same.
Okay.
See, comparatively, the hair Botox thing that's new, that's kind of better.
Okay.
With the less chemical.
All right. So I saw this, again on Instagram. I saw that you put castor oil in your navel, and apparently it detoxifies your skin and it helps you in acne. I can see from your reaction itself, it's stupid. But then, can you please tell us if that even works or no?
Okay, no, first castor oil.
I love that reaction. Okay.
Now, castor oil is very thick.
Right.
You drop it into your navel, it's not going to get absorbed below your epidermal layer.
Okay.
Now it's not going to go into your body and detox your skin, not at all.
Okay.
So it's done there, it's only going to stay in your navel.
Yeah, so that's it. Just going to remove dirt in your navel, maybe. All right, it's a good myth thing. Cool. So let's move on to the next part of the podcast. It's called Myth or Fact. So I'll be giving you some statements in the castor oil navel, and you can just tell me if it's a myth or a fact, and if you want to explain about it, you can. All right. You don't need sunscreen on cloudy days or when indoors.
Myth. You definitely need sunscreen on cloudy days and indoors now, because now you see the sun rays coming inside. These days has UVA in it. Now UVA is the one which is going to cause most of your problems. Your melasma, UVA will aggravate it. Freckles, UVA will aggravate it. Wrinkles, UVA will aggravate it, because UVA works deeper into your skin.
Okay.
It causes collagen damage. Aging also happens because of UVA.
Right.
So you need sunscreen indoors. Second reason, if you're going to sit in front of the system, blue lights, even more dangerous.
Okay.
UV rays, I wouldn't say it's completely dangerous, because I would say 50-50. 50% it is going to cause the damage, but 50% it is also going to give you a lot of good benefits, which is of course needed for us. But blue light is 100% damage.
Okay.
So you need protection to.
So which means you have to put sunscreen even in the night, right?
Yeah, if you're going to sit in front of the system and work.
Okay.
Yeah. If you're working in the night in front of the system, 100% you need a sunscreen or a moisturizer with blue light protection.
All right. Okay. Oily skin does not need moisturizer.
Again, a myth. Oily skin also needs a moisturizer, just a lightweight moisturizer, because the oiliness itself is a compensation mechanism for your skin. Now, if your skin is dry outside, automatically the glands are going to produce more oil to keep it hydrated. So, to reduce the oiliness, when you apply a moisturizer and keeps it hydrated, this feedback goes back to your gland and says, okay, now the skin is hydrated, I don't have to give more moisture.
Right.
Let me produce less oil.
Okay, all right. Sleeping on your side causes wrinkles.
No, sleeping on your side can cause pigmentation but not wrinkles.
Okay.
Like the side pigmentation can happen because if you sleep on one side.
Okay, interesting. Retinol thins your skin and makes it sensitive.
If you abuse retinol, it will thin your skin and make it sensitive.
Okay. Frequent hair washing leads to hair loss.
No, it doesn't.
Can you wash your hair every day?
I do wash my hair.
Okay.
So you can wash your hair every day. Just that use a gentle cleanser, like a gentle or a mild shampoo, or don't use shampoo on everyday wash. And don't use shower. That's it. You can wash your hair every day if you want to.
Okay. Oiling your hair overnight makes it healthier.
It doesn't make it healthier. It gives more moisture to your hair. We have oil production on the scalp. There is good amount of sebum, which has a lot of good factors, moisturizing factors, which gives a lot of benefits to the follicles because it's produced by our own body. Now you don't have to clog your pores with an oil, which can worsen things.
This is very confusing, right? Because as when we were growing up, வீட்டில் வந்து அம்மா வந்து எண்ணெய் போட்டு Yeah, like that's really good. That's how your hair is becoming thick and so on. Once I met a dermatologist, she mentioned the same thing. Don't use oil. You have enough oil in your scalp. But again, now I feel like the trend is back. Like, a lot of hair oils are back in the market. Marketing is being done in a way, use hair oil. That is what is going to make your hair thicker. So it's very confusing.
See, you need oil for your hair.
Okay.
Okay? Because this portion doesn't have seed. Now this portion is very dry. And this portion is also getting exposed to the environmental damages. The rays, pollution, the shampoos, products, whatever we use, styling, all damages done to this portion, and we don't do anything to rectify. If you have to use a very good oil to help in making this hair better and to keep this hair smooth and soft, you need coconut oil. Because that is the only oil which can penetrate into the cortex, into your hair, and repair.
Okay.
No other oil can do that.
Okay.
Okay, so it's not just going to be on the hair, it's going to go into your hair and repair your keratin damage.
Okay.
So you need coconut oil here. Now when it comes to the scalp, see, if you're getting an oil massage, it doesn't matter. You can get it done. There is no good, there is no bad. But oil is not going to give you hair growth.
Okay. It's not going to do any good, basically.
No. If you have dandruff, if you have acne, that oil can worsen the condition for you. That's because the dandruff as well as the acne happens majorly due to the fungus and the bacteria, which can grow when you leave the oil to stay after a certain point. Like when you leave it overnight,
Right.
6 or 7 hours, oil becomes a base for the fungus and the bacteria to grow.
Right.
So you do not need oil. And as said, we have sebum, we have our own oil. So again, you do not need oil.
All right.
Having said that, even when I was a kid, my mother used to apply oil, and my dad is a doctor. So he'll be like, this is not going to do anything for her. Ask her to eat healthy. If you need good hair, you better eat healthy. No oil is going to help you. It's like, okay, now I realize that.
Yeah, I get it. Okay. Grey hair grows back faster if you pluck it.
No, grey hair generally grows faster. You pluck it, you don't pluck it. Grey hair growth is faster than your black hair growth.
Okay, so
That's
once
a
it
science.
comes, it's just going to keep coming.
Yes.
Okay. Okay. So how do you kind of, is there any way to like
See, there are multiple products available in the market, but ultimately the grey hair is happening because of oxidative damage done to the cells. Again, it's only because of the stress to the cells. So there are a lot of antioxidants. You can keep using antioxidants. Sometimes it works, sometimes it doesn't work.
Okay.
So there is no guarantee it is going to work, but try your luck.
Got it. All right. Ice cubes on your face is good for your skin.
Okay, I would say partly okay, partly not okay. Again, depends upon how your skin is. Now, your skin is very dry, dehydrated, dull. Now, go dip into the ice cubes, it's gonna become more harsh.
Okay.
So, there you don't need it.
Okay.
And rather than dipping your face into the ice cubes, you can probably use ice rollers. Don't apply the ice cubes directly on your face, like use a cloth or any rollers, which can help kind of detox. That's okay, and it's again a very temporary thing to do, but no harm in doing it.
Okay. You should let your skin breathe by not using any products for a while.
Yes, again, true. Do not layer products, that's why. And at least give a period where you don't use anything on your skin. Like even on entire day, if you have sunscreen throughout the day, come home, wash your face and just let it be, like before you apply anything else.
Okay.
Let it stay for a while without any products. Your sebum kind of helps in neutralizing it. But this doesn't again apply to everyone.
Right.
Because there are people who have very, very dry and very dehydrated, breaking skin. And if you don't apply your moisturizer, it's going to cause more damage. So it applies for few people, it doesn't apply.
And that actually happens to me. I've tried because Niket keeps telling me, why do you always have to put something on your skin? Just let it breathe for a while. But the minute I wash my face, like in 10 minutes, it starts feeling very dry.
And
so I have to put something.
moisturizer.
Yeah. Drinking collagen supplements can help with aging.
Yes, it can help with aging. It's not going to reverse aging, it helps in healthy aging.
Okay.
So collagen degradation happens right from 30 years of your age. Slowly every year, and as you become more older, the destruction of collagen from your body is going to be high.
True.
So supplementing it with or replacing it with an oral collagen does help in keeping your aging in a good process.
All right. Melanoma only develops in areas exposed to the sun.
Yes.
Okay.
Majorly only in the areas exposed to us.
Okay. Botox and fillers makes you age faster once you stop using them.
No. Definitely no. Now let me give an example. You start doing Botox and fillers at 20 age and you decided to stop it at 30 years of age. The 30 years of aging will be there for you.
Right.
You can't look at like how you were in 20, right?
Of course.
So that is a natural process of aging. Even if you didn't do it, you would look aged for
Your age, yeah. Correct. Okay. So, any new project that you're looking forward to in this year?
Yes, but totally different from my field.
Just skin and
But
hair.
just skin and hair.
Okay.
Of course, I have my own products like the Kate Laboratories, which
Right.
is like the shampoos and serums and all that. But yeah, that keeps developing. But a completely new project of this is Mommy Check, which is for mothers. Not just mothers, like right from prenatal and even after pregnancy until the toddler stage. We are going to come and give a lot of information about the myths which is going around. And
Okay.
somehow I feel that maternity is a stage where a woman should be more strong,
Right.
but it's made more vulnerable.
True.
The anxiety, the myths around this is too much to handle for anyone.
Yeah.
And only the right professionals can give the right answers and can clear these myths again. Like how we already said, if you don't know, you have to ask.
Correct.
And there should be a platform where you have to come and ask,
Yes.
right? So we want to be a platform where you can come and ask your questions and you get the right information.
Lovely.
So looking forward for that project.
Okay, that's lovely. Looking forward to that. I think with that, we're almost come to the end of the podcast. But before I leave, I always leave with a word. I have a feeling you know this word, but still let me go ahead. Do you know what piloerection means?
Yes. What is it? Goosebumps, right?
Yes. Cool. So piloerection is goosebumps. I knew it, you'd know it. But anyway, with that, our podcast has come to an end. Thank you so much, Dr. Monisha. It was lovely having you. I think it was such a breeze talking to you.
Thank you for having me and thank you for asking the unasked questions. It was not like repeating the same thing for me and it was a very good show. Thanks.
Thank you. With that, it's time for us to leave. And like I always say, be good and keep